This bill is by far the most comprehensive piece of legislation addressing surprise medical billing offered by any state to date.
Compromise legislation to address surprise billing is unveiled this week, and medicine weighs in. Thanks for watching TMA's Legislative News Hotline for Friday, April 5th. Up this week, doctors provide wall-to-wall testimony in House committees on scope of practice, medical liability, child health, and other issues, progress on the state budget, floor debates could be the next step toward raising Texas's tobacco use age, an outreach program to draw young Texans into medicine gets a boost, but first, a new plan is set to address surprise medical bills. After the sometimes contentious hearing 2 weeks ago in the Senate Business and Commerce Committee, lawmakers who sponsored several of the bills aimed at addressing the issue had a meeting of the minds to reach a new compromise measure. Monday, Senators Kelly Hancock and John Whitmire and Dr. Representative Tom Oliverson and Representative Trey Martinez-Fisher hosted a brief news conference to announce they reached an agreement. The committee substitute to the original Senate Bill 1264 by Senator Hancock removes the patient from mediation and installs baseball-style arbitration between the physician and the health plan for most surprise medical bills using market-based benchmark data.
We've seen this proposal, the baseball style of arbitration, work extremely well in other states, and it actually does a few things which I think are pretty incredible. It actually expands expands networks, so improves network adequacy. It actually brings down physician charges, and it actually stabilizes the cost for a certain service so that over a period of time, all stakeholders on both sides sort of know what the value of that service for that particular marketplace ends up being.
The next day, the Senate Business and Commerce Committee approved that bill on a 7-2 vote. TMA supports this version of the bill, but still would like to see some improvements to it. The bill now can be considered by the full Senate. Meanwhile, also on Tuesday, the House Insurance Committee heard testimony on essentially two House versions of that same bill. Beaumont anesthesiologist and TMA Board Trustee Dr. Ray Callas testified in support of House Bill 2967 by Representative Oliverson and House Bill 3933 by Representative Martinez-Fisher.
Just because they're a compromise doesn't mean that Texas medicine is not going to continue to work hard to make sure that this bill comes out a little bit stronger. There's about 4 or 5 issues that we still have.
Both bills were left pending. Dr. Callas also testified in support of a bill to require the Texas Department of Insurance to examine PPO and EPO network adequacy at least once every 2 years. House Bill 3911 by Representative Hubert Vo of Houston was left pending. But the committee did approve several other TMA-backed insurance bills. 2 bills by Dr. Representative Greg Bonin, House Bill 2327 and House Bill 2387, require more prior authorization transparency and require utilization reviews to be conducted by a licensed Texas physician. 4 bills by Representative Julie Johnson also passed. House Bill 1832 would keep health insurers from using a final diagnosis to determine whether to cover emergency care. House Bill 2408 prohibits prior authorization requirements for state-mandated health benefits, such as mammograms and prostate cancer screenings. House Bill 2520 would require insurers prior authorization for elective care to disclose the physician's network status and patient's anticipated cost. And finally, HB 2630, which would require a health plan's network directory to clearly identify which physicians are in-network at in-network facilities. All of those bills may now be vetted by the House. It's crunch time for House committees vetting hundreds, thousands of bills. TMA physicians were right in the middle of it all this week. Marcus Cooper joins us with more on the bills that drew doctors to testify. Marcus?
Many bills heard in House committees this week could influence medicine and the health of Texans for years to come, so physicians gave their input. Let's start with the House Public Health Committee. House Bill 1792 would expand the scope of practice for advanced practice registered nurses, essentially allowing them to independently practice medicine. TMA has opposed similar legislation in the past and stands firm against this bill too.
What we're saying is nurse practitioners play an important role in delivering team-based care, and we think that that's where their expertise is best utilized. It's appealing to think that with extra training, they're qualified to do things, because I think sometimes physicians make it look easy. But that training is not there, and it's really just not comparing apples to apples.
Physicians told lawmakers they oppose a bill that weakens the liability protections for physicians who give emergency care in a hospital setting. House Bill 2362 would make liable any caregiver in an emergency situation or if the patient's condition worsens, regardless of whether the doctor committed an error. Austin area obstetrician gynecologist Dr. Moss Hampton says removing the existing willful and wanton protection for physicians is unreasonable.
Even if somebody else in the room does make a very minor mistake, then everybody in the room is going to be held liable for that mistake. And we just feel that it's not fair to get blamed for another person's mistake or to have to pay a price for an inadvertent happening during an emergency. And we all know that emergency situations come up and they are difficult, lots of moving parts, lots of potential for error, but if we didn't cause it, we shouldn't be blamed for it.
House Bill 2453 proposes critical reforms to reduce red tape and enhance oversight of Medicaid managed care services. Among the reforms, House Bill 2453 would improve communication between physicians and Medicaid managed care organizations, identify best practices for care coordination, and reduce red tape for Medicaid prior authorization. TMA President Dr. Doug Curran credited the bill's author, Representative Sarah Davis, for collaborating with medicine to set up strong reforms.
Representative Davis has a bill that's going to help facilitate improved transparency so that we can kind of know what to expect. We have some idea of expectations from managed care companies, so there's no surprise there's another prior authorization, surprise there's nothing available for this patient.
House Bill 2231 by Dr. Representative Tom Oliverson proposes new guidelines to regulate the Pharmacy Benefit Manager Program, or PBM, and prevent meddling with patient-physician care. The bill adds new penalties if PBMs obstruct or delay pharmaceutical care. It also would prevent price markups on drugs physicians prescribe.
As a cancer specialist, I deal with PBMs quite a bit, and it can be very challenging, sometimes because there are delays in patients getting the appropriate therapy that they need, and more often, care being taken away from the physician-pharmacy relationship can be a real challenge in appropriate and just-in-time care delivery.
An initiative to align Texas child care facilities with national standards gets a hearing in the House Human Services Committee. House Bill 1808 requires child care physical activity, nutrition, and time spent on electronic devices to comply with American Academy of Pediatric standards.
It's an appreciation that the earlier these messages and healthy environments are created for children, the better, and not being able to put it off until they're adolescents and can make their own decisions. So it's realizing the importance that we as adults play in their lives.
All of the bills I mentioned are pending in their respective committees. Brent, it was a busy week, but a lot of progress. Back to you.
Thanks, Marcus. We are one step closer to having a budget. This week, the Senate Finance Committee unanimously passed its spending proposal for the next 2 years at a total of roughly $248 billion. Compare that to the House's budget bill passed unanimously last week, a $251 billion plan. Now, the full Senate will vet the Senate Finance Committee's budget bill. Ultimately, a House-Senate Conference Committee will hash out the differences between each chamber's proposals later in the session. We will share more on the spending plan details in the coming weeks. A tobacco use age bill progresses. On a 5-4 vote Monday, the Senate State Affairs Committee passed Senate Bill 21, the bill to raise the tobacco and vape use age from 18 to 21 years of age. Senator Joan Huffman's bill now awaits debate on the Senate floor. TMA and the Texas Public Health Coalition testified in favor last month, as well as for its House companion bill by Dr. Representative John Zerwas. That bill awaits a House floor hearing. Special testimony this week in support of a bill to expand the Joint Admission Medical Program, or JAMP. JAMP would add the UT-RGV School of Medicine and the UT Austin Dell Medical School under House Bill 2573 by Representative Oscar Longoria of Mission. JAMP helps economically disadvantaged students get into pre-med courses in medical school and provides scholarships, internships, and mentorships. Third-year medical student Ankita Brahmaratu told House Higher Education Committee members that the program gives young people an opportunity they otherwise might not have.
I really think the difference is made by getting some of these people into medical school who otherwise wouldn't have done it, and showing them that they can make a difference in their community. And of course, as you know, we do better when we see doctors that look like us and understand our communities.
Finally today, 400 physicians, medical students, and TMA Alliance members came to Austin for the first Tuesdays at the Capitol event this week. Look at all those white coats. Doctors from all corners of the state trekked to the Capitol to advocate for medicine. Hundreds of aspiring doctors bussed here too from their medical schools to meet with lawmakers. Your last chance to participate this session in First Tuesdays will be on Tuesday, May 7th. That's all for now. Please like and share this video with your TMA member friends and get the latest updates from TMA Daily Hotline in Texas Medicine Today. With TMA's Marcus Cooper, I'm Brent Anier. Thanks for watching. Please join us again next week for TMA's Legislative News Hotline.